Welcome back to Foundation Physical Therapy's YouTube channel. Today we're going to show you an activity commonly referred to as a sleeper stretch, and it's an activity to improve the internal rotation of the shoulder. A lot of times with throwing athletes, overhead athletes, we find that they have some impingement problems or anterior shoulder pain. That can happen if you lack internal rotation. When you're doing this overhead motion, this here is internal rotation. If this is short, or if this is limited, then what will happen is the entire shoulder complex will tip forward, and then you'll find a shoulder that basically is doing this, right? So you can look in the mirror at your profile. If you find that your shoulders are not lined up directly under the ear, this is a good thing to check. So just to check your internal rotation, what you can do is lay down on a surface, on a table or on the floor, and you should feel like you should be able to keep the shoulder flat and almost tickle this table, right? Just like that. If you find that you're here and this whole shoulder complex and the shoulder blade is coming off the surface, then this would be a good activity to do. So what you do is you lay on that same side shoulder and be very gentle with this. I mean, it can be very uncomfortable and you can do yourself some harm if you're over aggressive. So you should feel the mild discomfort at worst. You shouldn't feel any pain. Ideally, I might get a pillow here just to kind of support my head. This foam roll will do. And so what I'm going to do is get this shoulder straight out get this arm straight out from my shoulder. I'm going to grab here onto the back of my wrist, and I'm just going to slowly push down. Okay? And when I want to make sure that this shoulder doesn't migrate down and I'm here, that will give me the appropriate stretch. I want to get it here, straight out from the shoulder again, and then I pull down. And at first you may start with just a 10-second hold and then relax off of it. Right, again, I'm not getting any kind of pain with this, it's just a gentle stretch. Then eventually work up to the point where you can hold this for a 2-minute hold on a gentle stretch, and then bring it right back up. So it'll help improve your internal rotation. If it's limited, do that quick little assessment, that little test. If you can't reach the table, then try this out. Careful doing any kind of throwing immediately after this stretch if you're very limited. Just might feel awkward and cause some discomfort. So this is something you do on your off days, on your rehab days, where you're trying to improve your performance.